Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Next week, we're launching Climate Mondays, a series of episodes dedicated to hope and change. Over the next few months, we hope these conversations with leaders working at the intersection of climate change and public health will bring fresh energy and hope to the topic. Big thanks to Shelley Hearn, director of the Johns Hopkins Lerner Center for Public Health Advocacy, for guest hosting this special series. We hope you enjoy these interviews, and as always, we welcome your feedback to our email, publichealthquestion@jhu.edu. Today, the podcast turns to the Trump administration's interference with the Centers for Disease Control and Prevention during the pandemic. Congressman Bill Foster, a member of the Select Subcommittee on the Coronavirus of the House of Representatives, speaks with Dr. Josh Sharfstein. They discuss the subcommittee's recent report examining in detail the various ways that the Trump administration undermined the nation's leading public health agency. Congressman Foster is a PhD physicist who worked at the Fermi National Accelerator Laboratory, giving him a unique vantage point of the intersection of science and politics. Let's listen.
Congressman Bill Foster, thank you so much for joining us on Public Health on Call to talk about your committee's report called "It Was Compromised: The Trump Administration's Unprecedented Campaign to Control CDC and Politicize Public Health During the Coronavirus Crisis."
Well, thank you, Josh. I really appreciate this opportunity. There's no shortage of lessons learned from the pandemic, and it's one of the major goals of our select committee on the coronavirus. But one of the lessons that stands out is the damage that's done when you politicize what should be scientific determinations of the current state of knowledge during a public health emergency.
Now, to do this report, which I have to say reads incredibly well, comes in at 94 pages with like 380 footnotes. So it is not like a quick look. You really dug into it. This investigation and what Congress can do is so much more than just pulling different articles that have been written or different allegations. Could you talk a little bit about the committee's work that produced this report?
Well, first off, we benefited from just a spectacular staff on this. Any member of Congress, even a chairman, has a very limited amount of time to devote to any subject, and we depend on the staff. And particularly if there are out there talented public health officials who want to do something for their country, consider serving on the staff of a committee.
The second thing I noticed was that these political appointees that you were talking about at HHS would edit different things that the CDC would put out to reduce the sense of concern and alarm that might have been a natural consequence of just hearing the truth.
That's right. The President Trump, clearly evaluated his success on the performance of the stock market. And in fact, when the truth about the severity of the pandemic came out, it had a very negative effect on the stock market. And so if the solution to that is to not tell the truth about the severity of the pandemic and the likelihood of how it will develop, then we have a problem. And it's just one of the examples of the incentive to underplay the severity.
I mean, one of the real head scratchers in this report is one of these political appointees saying something to the effect of, let's go out and tell more stories of very old Americans who did fine when they had COVID-19. That's the story we want to tell.
That's right. I guess we're both scientists enough here that statistics that matter. But we also have to understand that a lot of explaining public health is by anecdote. And as a scientist, this is one of the toughest things for me to come to terms with. And I understand why they thought maybe a few positive anecdotes could overcome the reality of the grim statistics that our country is facing. But the CDC's job is to report the statistics up the command chain and the facts to the public.
One of the most disturbing aspects of what the committee found is that CDC reports were edited by political appointees at HHS and the White House and essentially just posted as CDC documents. They weren't posted as, this is the CDC as edited by the White House. It sort of like showed up on the CDC site. And these were major changes in some cases to what the CDC was recommending. And you had people inside the CDC telling you that they thought people would die as a result of these changes. But from the outside world's perspective, it just looked like the CDC had posted it.
That's right. And, the Trump administration's behavior was not confined to the CDC. The EPA had exactly the same problem where political appointees were put in there and edited the scientific findings of the scientific personnel. Well, this is very bad for the morale. One of the first hearings that we had when Democrats took over was actually looking at the damage to the federal workforce that was done by the politicization and the ignoring of the scientific results, both at the EPA and elsewhere in the scientific.
Why do you think the political appointees feel that it should be posted as a CDC document when they've essentially rewritten it? Why not release it out of the White House? Why not say, the White House is going to be doing the guidances and we happen to disagree with the CDC, so here's what we think. Why didn't that happen?
Why didn't that happen? Because the Trump administration political appointees wanted to take advantage of the public trust in the CDC to amplify the spin that they wanted to put on what they hoped was the non-severity of the pandemic.
I want to ask you a tough question, because in this report, there are many people at CDC who are really struggling with whether they could stay in their jobs. A few times they said, I almost resigned over this. For Dr. Redfield, it happened to be related to the cruise ship order. I almost resigned over this. Do you think there should have been more opposition within the CDC? And I mean, particularly from Dr. Redfield. I mean, here you have CDC reports being rewritten. You have CDC not being able to talk to the public, the risks being downplayed in ways that really was alarming the scientists at the agency. Should CDC have pushed back more?
Yeah, the rubber meets the road here at the political appointee level inside the agencies. And the political appointees ought to be people with scientific credentials. They know bad science when they see it being forced upon them. It is my feeling that if I were in that position, I hope that I would have resigned earlier. I have the private cell phone numbers of some of the people that were struggling with this, and we're exchanging texts with various senior members that were trying to understand the circumstances under which their duty to the public would be optimized by either resigning or not resigning. Because if everyone decent leaves the field, then the field looks pretty grim. And so there is some merit to just gritting your teeth and standing behind the president when he makes ridiculous pronouncements. Sometimes the camera catches you. It catches you grimacing when the administration does something that's clearly unscientific. But the career people, I think that one of the most important duties of any political appointee is to defend the career people inside agencies. And then when the career people get attacked, and which the Trump administration very publicly did, they very consciously tried to discredit the CDC's integrity. One of the incident managers, Dr. Jay Butler, was one of the incident managers for the COVID-19 response in 2020, described how the Trump administrations were intentionally discrediting CDC's integrity, and just what a horrible effect that had on morale. It's tough.
Yeah. I mean, the MMWR, the Morbidity and Mortality Weekly Report, sort of comes across as a big example in your report that this is considered the pride of CDC. People take a lot of attention, pay a lot of attention to the details of the articles that are published there. And never before had there been this level of political interference, which to some extent was brought in by the CDC director, who was trying to negotiate after some opposition from senior political figures in the White House and HHS.
Yeah, no, it's one of the worst case things, because that document, that weekly report, should, I think, be viewed as sort of, here is the underlying basis of fact on which we make policy. And when you're distorting that underlying basis of fact, then there's a real problem. because there's no assurance that either the public or the more senior officials will correctly understand the nature of the threat they're facing. It's like the body counts in Vietnam, for those of you who have a certain remembrance of just, you have to have the truth reported up the command chain.
What's interesting to me, I'll just say this before we go on to what can be done, but what's most interesting to me reading this is that people have been so critical of the CDC through the pandemic. I think not totally appreciating the degree to which the CDC wasn't really the CDC, particularly during that first year.
That's right. They were certainly subject to huge forces. And there are structural criticisms that I think are legitimate. They very often, it's pointed out that they seem to view themselves more as an academic organization rather than a real-time public health response. And so that sort of mindset may have, for example, caused some of the problems with the testing that are widely cited. But also some of it, frankly, is not their fault, in that we have this crazy quilt of federalized data collection that's not standardized, and this caused huge problems in really understanding what was going on.
Recognizing there are a lot of factors, I think this issue of interference really hasn't been as much part of the conversation as perhaps it needs to be in really assessing the role of CDC. But I want to talk to you about where to go from here and the conclusions that you draw for what we can do better to protect health agencies and have more successful health agencies without this level of political interference.
Yeah, well, I think a lot more clarity on reporting requirements at all levels would help, so that we actually understand what the frequency of various public health threats are. To my mind, that's one of the highest. It would make it much easier to resist a politicization if you're just following rules that are agreed upon in advance. There were instances where apparently a governor of the state, will remain nameless, sort of arranged to have some people who were setting up websites to get the facts out to the public removed from their duty to do that. And so this sort of thing is not okay. You should have both the reporting to the public and the reporting up the command chain well rehearsed, standardized, and in advance of a pandemic. That's one of my lessons to it. The other thing is we have to have very strong norms on the behavior of political appointees that are temporarily in charge of agencies, because it's fundamental to how our system works, that has been vilified as being called the deep state. When a political appointee comes in and wants to sit there and give orders and fire people and know there are actually rules that must be followed, there should be limits, for example, to what someone with an acting position can do. That was a norm that was followed for decades prior and seems to be completely obliterated by the Trump administration.
It sounds like in some cases you had Senate confirmed people in this report kind of participating in the politics. It's not just about acting versus not. I say that as a former acting director of an agency, but it is also about Senate confirmed people. And I wonder whether part of what you're saying is these people who are entrusted with agencies have to be willing to draw the line, even with their own boss in some circumstances.
Yeah. And I think that's a question that the Senate should ask of every confirmed appointee. Where are the lines at which you'll say, all right, my duty to the agency that I am overseeing and my duty to the American public will and should overcome my self-interest in advancing my career within the current administration. And because that's a line that every appointee should think about in advance. Were I in the Senate, it's a question that I would ask of every appointee that came up for confirmation.
Congressman Foster, thank you so much for your focus on this issue, this tremendous report, and bringing your own scientific understanding to Congress to help improve health policy in the future.
That's right. And I have to say, I'm a little less lonely than I was as a result of the previous election. There is now another PhD scientist in Congress, a PhD chemist that recently elected that I look forward to working with. Hopefully that will cut my workload in half.
Well, we can all hope. Thank you so much for joining me today.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin. with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.